chores.
Yes, chores are great. And it's
good.
interesting. My mom sometimes was like, how about you give them a little allowance? I'm like, Mom, there are certain things in the family community that are just needed. I can't pay my kids to breathe. Like, so.
Right, they would like you to.
They make their bed. They didn't know that's expected of them. Occasionally, if they're too busy, I'll make their bed fine. But like
okay
they
too.
can set the table. Maybe I have to teach them how to do the laundry. Like they have to know these things.
I think about specifically my boys' wives someday.
Yes.
And I'm like, I don't want them to be mad at me.
Yes.
I want them to have full functioning, helpful, thoughtful adults.
I have to say that is one. Maybe my mother-in-law and I weren't quite as close, but I am so grateful to her for raising a good son. Really, she did teach him how to cook. She taught him how to do everything. Yeah,
that's beautiful.
So it's really, and it was an interesting story. She told me he liked when she made lunch for him for school, and into high school he said, I really prefer when you make my lunch. And she said, well, I'll make your lunch as long as you cook dinner once a week for us, So
I love that.
So then she said, well, it taught him how to cook and it taught him how to, so be independent.
Don't we want to raise resilient kids? I mean, the growing up process is beautiful and painful at times, but don't you want to raise resilient, wonderful, independent people? So you have 3 daughters.
Yes.
What are their ages?
So my oldest is 19, 17, and 14.
Wow.
Yeah.
So 2 in the house.
2 in the house now, yes, which is a big jump. Having 1 out of the house, so we have more space. It's like a little bit of a,
That must have been a big change.
It was. I mean, we miss her though,
I'm sure.
and we have 2 dogs too.
Oh, you have a full house.
Yes, we do, and it's interesting how the dogs now will sleep on her bed. Yeah,
they miss her.
Yes, they miss her.
When will she be back?
She's back for I guess spring break.
Spring break.
It's a different one than my daughter's, unfortunately. But yeah, sometime in March. End of March, early April.
Yeah. How have how has your perspective on beauty and self-care changed since having daughters?
Oh, wow. I thought about that.
I know.
I would say from 2 different perspectives. One was that as my children were growing up, you realize you're their example. And, that saying, do as I say, not as I do, they're going to follow what you do. Right. So oftentimes, and I remember also as a physician hearing friends who had parents who were doctors say they never wanted to be a doctor because they never saw their parents, or I didn't want to ruin medicine for them, but I also, even just the idea of working mom, I didn't want to miss their growing up.
Sure.
But so exercise, and then I realized exercise as they got older helped them manage their stress too. So then we were sometimes doing that together, at least when they were in high school. So one of what I think was to be a model for them. And then the other one was also, maybe moderation, because we're just inundated with all of this information, and experts give you laundry lists of all these things that you have to do, and it's sometimes just not sustainable. So,
it's not.
Having a healthy life and walking the walk in a way, and also doing what's reasonable and manageable and what feels good for the individual. I really trust my own instincts with things, and I want my children to learn to listen to their inner voice and trust their instincts. So what's reasonable for them. So I think in those ways that helped me kind of put that in perspective in a way that's reasonable.
You do have a high pressure job.
Yes.
Long hours, I assume, at times.
Yes. Yes.
High precision, high pressure. How have you been able to balance that life and then put on your mom hat?
Yeah, well, that transition is hard. I almost think it's easier to do one or the other because the speed, especially when they were younger, you really had to slow down and be in their world. And that switching of gears was I found very hard. But I think the only guide was that you have to remind yourself to be in the moment, or else you're going to miss it.
It's hard.
So yeah, being in the moment and standing in their shoes in a sense, and realizing how they're receiving you after where they've been all day.
Has it been harder to balance in the early years or the later?
Oh, interesting.
And I mean later in that teen.
Well, I think the early years, I I remember being asked that and saying, well, it's a bit like running bases. I really felt like I was just constantly, you know.
Yes.
And people would often say to me, well, Lee, how do you have time for you? And I really felt like my work was for me. Do you know what I mean? Like, I found it so rewarding, and joy, you know, giving me such joy and satisfaction that I felt like that for me was sort of like getting my hair done. Like, you know, it just seemed, it was, and, you know, I really like helping people, I guess, and my patients are amazing. So, like, you know,
You love what you do.
Yeah,
I don't think many people can say that.
So, so that's one element of it. And the other is I had a mom who stayed home with me until I was in about 5th grade. And she was an amazing mom. And I didn't want to not have a strong presence in my daughter's life.
Sure.
So being in my own practice on one level gave me the ultimate flexibility. And I almost feel, you know, if you're thinking of on the spiritual level, God kind of gave me as much as I could handle, you know, and I remember sometimes in those moments when I would feel like, wow, this is getting kind of crazy, just kind of taking a breath and saying, when I have nothing to do, I may be like an old lady sitting in a nursing home, thinking back to these days when I had so much going on, and with joy, like thinking of that. So let me just try to just ride these waves and
That's a
just
beautiful
do it.
perspective, because when we have that feeling of doing it all, we're going to fail.
But it's not about doing it perfectly. You know it's messy.
It's not possible.
You know, you just have to kind of face whatever it is and prioritize what's really important. I think those are kind of...
you have such a beautiful calm about you.
Oh, thank you.
Yeah, you are, do you feel that your spirituality has helped you keep things in perspective and keep that calm in the storm of New York City?
Yes, I know I definitely do, and I ask God to help me all the time.
I feel that.
And you know, sometimes even when you're approaching a patient, let's say it's an operation, and things aren't always, you know, what you think they are, because once you open the area, then you get to really see what's going on. And handling those curveballs, I have... it requires a bit of flexibility in your mindset, you know, that, well, this wasn't how it was I expected it to be, but now let me work with what I have.
I was going to ask you what lessons in motherhood helps you become a better surgeon?
Oh, yeah, that flexibility, you know, absolutely.
See that.
Yeah, you know, when someone spills something all over the place, you just have to go with it, right, as a child, dealing with a young child. And the same thing, you know, I think in surgery is, you know, you go with what you've got and become a creative problem solver. So
you live on the Upper East Side?
I do, yeah.
And your practice is on the Upper East Side?
Yes. I've always had my office very close to my home.
How close?
A block away.
Okay. Lee, you have the ultimate commuting dream.
Yeah, right. It's treacherous. It really is.
It's incredible.
But I always did that. And so we've lived in different areas in the city, but I've always been close to home within walking distance. And it was so helpful to, one, be able to run back if I needed to. And I will say that one of the things that was so wonderful for me when my children were very young is I had an amazing babysitter who's an older woman who had flexibility, wisdom of raising her own children. But I also had my mother-in-law and my mother.
Oh, that's incredible.
And so we had a very sort of stable support system. And then I had my husband, who even though he has a very demanding job also, you know, when he could, he was always there. And if I had to leave because I had an emergency, no problem, I've got it. You know, so
what does
that
he do?
He's an investment banker.
Investment banker.
Yeah.
So you both have high pressure.
Yes.
Different,
yes.
but
and
high
I will
pressure.
say that what we share in common is he loves his job as much as I love mine, in a sense. So I feel that we understand one another from that perspective, and professionally can be supportive in that way.
Definitely.
You know? So,
that's beautiful. I love hearing about relationships and marriages that are true partnerships.
Yes, yeah.
Because, you know, you always hear about this 50-50. When is it ever 50-50?
No,
the
it's
person
not.
helps as needed.
Yes, yeah.
It's you're a servant to each other.
Yes.
You're helping each other out. You're lifting each other up.
Yeah.
What inspired you to become a plastic surgeon? And why facial aesthetics?
Yeah, it was a process, I think, because when all of my life, in my young life, people have asked me, do you think you'd want to be a doctor? And it's like, well, maybe. I don't know. But so it was sort of on the table. And then I was very good in math. And our science program at Sacred, I went to Sacred Heart also. My daughters are there. And so their science program was sort of developing, and they hired a really great teacher probably my junior year, and I sort of realized, oh, science is sort of easy math, and I kind of like this. So I knew that I could do it, but even then, that commitment to become a doctor was sort of the big thing. I didn't have doctors in my immediate family.
I was going to ask.
And so we have a host of lawyers and many generations of them, but distant cousins, but not like doctors in my immediate family. Sure. And my parents had a very close friend who was a pediatric cardiologist, so one who was a woman. So, but not many women examples. And I did know that I like to help people. Like I knew that, but other than that, it was a decision that really required a lot of courage too, because at the end of the day, you know, will I be enough? Will I be able to make it? Well, you know, it's challenging. Will I? And so I didn't. My freshman year in college, my brother sort of said, "Don't do that. You'll have no life. Don't become a doctor. Don't be pre-med." And so I listened, but then my life had kind of no meaning, and so I couldn't start mid-year in freshman year because the cycle began fall to spring. So sophomore year I began, and I just had to say to myself, if I like it and I do well, I'm going to do it. And if I don't like it and I don't do well, I won't do it. I'll do something else. Sure. So, but I was really committed from the beginning, and I finished it in 2 years. And I didn't know why, but for some reason I did not want to take a gap year. And that was important because later on, when I decided that surgery was what I loved, you know, many women were putting surgery aside because they said, well, I'm this old now, and it will be 7 years from here after 4 years of med school. And I don't want to be, you know, such and such an age by the time I'm finished. I was the youngest I could possibly be. So I just felt like that wasn't, you know, on my list of sort of deciding factors. Yes. And I felt, you know, because I had a little bit of freedom because I had time on my side in that way. And I remember people saying to me again, well, you know, you'll have no life as a surgeon. You know, I said, if I'm happy doing it, I have a life, you know. And I couldn't just determine then if I would end up meeting the right person. Sure. But what I had control of is what I could choose as a career. And if I wasn't happy in that career, then other things would fall into place, sure. Whatever. But so there were, you know, it was just such a process. Looking back, though, you know, my thing I did best in my first year of med school was head and neck anatomy. You know, I didn't even know by graduating from medical school that I'd be a head and neck surgeon. It's sort of, again, it was all a process. And I think, again, having that flexible mind where things kind of drop in your path, and, you know, being open to not having blinders on, but being open to possibilities was a very important part of my, you know, training.
Yeah.
Yeah.
I feel like you have to have a calling for head and neck. Yeah. I really feel like not many people can just fall into it. There has to be a passion and a desire that leads you there.
And it's true. And the other thing is even though I graduated from medical school in 1997, which wasn't that long ago, but even at that time, you know, the doctors, maybe they felt a sense of responsibility because of the time commitment for surgical training, but they were not encouraging women to be surgeons. And it is hard. And I would say for men and women, if you could think of doing something else, then you should do that thing.
Definitely.
But yes, so that passion was it. I was at a reunion and a friend said to me, who was a really accomplished doctor, said, you know, we were just never encouraged to go into surgery. And I thought, well, some of that is true, but if you really have a calling, because I didn't listen, you know, even though people told me this is not a good field for you, you should do this or that. Or
because of the marriage, the kids?
Yeah, thinking, component? Well, you'll probably, assuming that you'll want to balance life, etc. And to some extent, that is true. Yes. I mean, I had a wonderful experience in my training in cardiac surgery. I loved it. And I think I loved the surgeons that I worked with who were so knowledgeable and skilled and dedicated to the patient. You know, I love that. And it was such a immersive experience, you know, all-consuming and really satisfying and rich and stressful. But I didn't see that in the end, I knew at some point I would want a family. Sure. And I didn't see that lifestyle would enable that kind of flexibility.
It's your perspective.
Yeah. I mean, my dad was always such a support to me.
That makes sense.
I mean, my mom was too. Yeah. But my dad was like, how about neurosurgery? You know, and I was like, you know, he kind of couldn't care less if I...
That's a big, that affects our, you know, our relations with our dads. You could do anything.
Yes, exactly, exactly. So
it's life-changing.
But it's, you know, I guess, and I have an artistic side. So that was the other thing. Like growing up,
both sides of your brain, Lee.
Yeah, yeah.
That's
and I was
amazing.
an English major, and I love theater.
And you're good at math. What can you not do?
Oh, thank you.
Well, you are a leading plastic surgeon in a predominantly male field. What did you have any challenges when starting your practice in New York City?
It's funny how yes, the answer is yes. Along the way, I did, but in a sense, and I don't know if this is me or just you sort of take it all the hardships and the good together. And while there may have been challenging individuals to work with, I had so many incredible people that I met and had the privilege of working with. Yes. And there's so many, you know, male colleagues who I just adore, you know, and they've just been, they're just such positive relationships. So I feel like the challenges were the growing parts. I got through it. I learned. I was stronger. Yes. And they were moments when, you know, they were opportunities. There was a wonderful surgeon I worked with, or I had the privilege of knowing for about a month in a rotation at the Brigham in medical school. And this is when I really had my first immersive experience with plastic surgery. Yeah. And Dr. Mulliken, and I remember he was, you know, heavily involved in research also, and he would stop a meeting and focus on someone's mistake, because he wanted to kind of understand what led them to that error, but also maybe that there's a thread of truth in that error that would shed light on what we really needed to know.
Wow.
You know, so it was such a positive way of seeing like difficulties are opportunities. Yes. And any time that I, you know, came into that, I think that really helped me kind of.
And no doubt there's amazing male plastic surgeons, everyone knows that, but I would think in some cases a woman specifically would choose another woman.
You know, it's interesting.
In some cases.
And also men would choose women sometimes. I thought that was a little bit surprising to me. But, you know, sometimes there were things that a man could speak to me about or get and he wanted sort of that feminine perspective to sort of shed light on what he was grappling with. So it was very interesting how I expected that it would be, you know, mostly women that I'd work with, and it is, but I also have amazing male patients too.
I didn't even think about that.
Yeah, so it's, you know, God made us both, and we couldn't do one without the other, right? Yes. So I think that, it's all good, and we have.
Did you have a moment in your practice where you're like, I've made it, I'm here?
Yeah, I don't know yet. You know, it's interesting.
You'll let me know? I'll tell you, you've made it.
I sometimes mentor younger students and younger women students, and you know, some are thinking about going to medical school, some are deciding what they want to do after medical school. And I remember graduating from medical school, and for years, you know, 4 years of college and then 4 years of med school, that idea of getting that degree seemed monumental. And here I was now at the peak of some hill, and I was still the same person. Yeah. You know what I mean? Yeah. And it was a little bit anticlimactic. Yes, I was proud of everything, but I don't know. I just knew I wasn't getting off the escalator in a way. Sure. And I sort of feel that way still. You know, there's just more to know, more to, you know, more growing to do. Yeah. And what's very exciting is, you know, unexpectedly a patient will come in with something, and, you know, being able to tackle that unique thing based on knowledge that I have or application of something I have in a new way, you know, it's just very satisfying and exciting.
I wanted to talk about that. Well, I first wanted to get into, what do you think the biggest misconception of plastic surgery would be?
I think still some people come to me and it's almost like a confession, like, I'm not vain, you know, like thinking that it's all about vanity. And it's really not. I mean, it's somewhat taken a turn to a wellness category when it's at its best, in sort of taking care of yourself and wanting to look as good as you feel. And that's been, I'd say, even for the last 20 years, definitely been a theme, but I still do see people who kind of bring come, with a little bit of guilt about this, knowing that they're very fortunate, they have their health, et cetera, and they, I think another side of that, though, is that they don't want to lose themselves. That's sort of a thing that in the last 10 years, for sure, people see these dramatic changes, maybe reality TV shows that have shown them these dramatic changes, but they also may say, but that person doesn't look like themselves anymore, and I still want to look like myself. Yes. So, and that I think is such positive self-esteem that, someone can say, I just want to look good for me.
Right,
and
I feel like back in the day, people were like, I want this person's nose, I want this person, but now they just want to look like them, but 10 years younger or 15 years younger.
And noses can be such a defining characteristic, and can you just soften it or soften other features relative to it to kind of make everything look more balanced?
Do you think the shift, the perspective has shifted, the perception has shifted in aesthetics and plastic surgery?
Yeah, it's just evolved.
I think so too.
And we have all of these tensions between, greater knowledge, better technology, but also even in surgery, like going deeper and maybe being more aggressive in surgery to try to find the ultimate solution. And then sometimes taking a step back and saying, well, we know this, but do we need to do that on everyone?
I was going to say, how do you find that balance? And the enhancements and their natural beauty. Do you ever say no?
Yes, yes, you do. Yes, because I can only do what I feel comfortable with. The other thing, though, is it's very important not to judge someone. If, let's say, the request is small, and they may be beautiful, and you may think, wow, if I were them, that wouldn't bother me. So you kind of can't, you have to keep a very open mind in dealing with patients, really listen to them. And sometimes some of my happiest patients had the tiniest little request, and I felt like, well, it's barely anything. You don't need to, in my mind.
But it bothers them.
But it bothered them.
That is important to them.
And it's a big relief. But I love that people nowadays are bringing themselves to this as well. And in a sense, there is some research about the subconscious and how your own subconscious helps you heal. In a sense, I feel like it's a bit of a collaboration with your patient, when you listen to them.
Therapist.
Yeah, so
you were walking them through one of the biggest changes of their lives. Scary too,
and
unknown.
On the face with identity issues, etc. You have to prepare people.
So you carry
for
that
those.
as you're taking people on. Does that pressure feel?
I mean, great? I guess I like it. And I'm not the only one. There are sometimes some people feel that surgeons are very direct and not as compassionate, et cetera. But there's a population of surgeons that did very well in psychiatry, and I'm one of them. So but I find that it's so beneficial to me because those are the things that the patient may not be saying that you still need to take into account, observe, factor into your decisions on what you would recommend for them.
Well, beyond the physical exam, how do you ensure a patient is ready beyond that?
I try to give them a lot of information and time. And I like to see them like 3 times before I'll operate on them. And in that time, they have a lot of reading, that I give them that will help give them information and give them an opportunity to ask questions. And, I hope that I'd underpromise, overdeliver, I want them to have a realistic expectation. Setting those expectations is so important. And you really can't make, even if you have goals, you can't make guarantees, with things. So we talk about that as well. And then I also want to take into consideration, what their expectation is in terms of recovery and healing, and do they really have the time for it, or maybe they should do this now and something later. So there's so many things that are involved. But
do you promote holistic approaches for the healing and recovery process?
I do. I mean, we use things like arnica and bromelain and talk about diet, and certainly smoking, and smoking of any kind is really not good around surgery. And inevitably, it may come up to lifestyle things too. It just, exercise, and when you can, when you can't, how do you, get into that. Many times, now we're dealing with a lot of Ozempic, people who are having side effects from Ozempic, from the weight loss and the lax skin and hair loss, et cetera. So we're managing that. But sometimes people come in, they'd like a facelift, but they'd also like to lose 30 pounds. And you know, how do we help them reach their goal so that they can, you know, and or maybe there's maybe it's 15 or you know, like what's reasonable. So I do talk to them about all those things. And
we'll get into your medical procedures, but going back to the facelift, the facelift techniques have evolved so much over the years. I mean, just we'll keep it positive, but just a side note, you see it, that, you know, a person who had a facelift 30, 40 years ago, and today it is shocking. Literally, people are looking just 10, 15, 20 years younger at themselves. How have you, what are your techniques? There's so many different things people hear about. Deep plane.
Yeah, you know, I think that when I've been trained in all of them, and I think and that's really important. And being able to keep up with those techniques is extremely important. And then it's your choice. And then it's also considering what the patient's circumstances are and goals are. But you also have to ask yourself, with all of the new things that come out, is this going to be good for the patient long term? You know, and what is a long term result? Is it 10 years, 15 years out? Yes, it is. Sometimes it is. And so whenever I'm kind of deciding what I want to take on, I also want to think, will this serve them well in the long term? I think that it's interesting, there's a bit of tension between, you know, these more aggressive surgical techniques and the lesser aggressive ones. And there are a number of patients who say, you know what, you know, based on my age, if I have 10 years, that's great. You know, I don't want to recover for 6 months. I want to recover quickly, you know. So those kinds of things are shaping our techniques. The other thing that is the use of some technology in a more measured way, in a more thoughtful way, combining things, is huge right now. And we have the information now where it's not just, you know, and this is very true with technology. It gets introduced, we sort of see its limitations, maybe we reformulate it so that it has less of the negative side effects and more positive, and we use things differently, and so that's sort of an evolution too, and being able to use things in a more thoughtful, careful way. You know,
I mean, it's high stakes, so all these new advancements, you have to be really careful, and so you're watching, you're measuring.
Yes, you're using your surgical knowledge, the anatomy, to really, even when it's applied to technology, to do what's logical and what makes sense.
Well, any cutting edge treatments you're doing or that you're seeing coming down the pipeline that you're excited about?
There are, I mean, you know, in the world of rhinoplasty, something called preservation rhinoplasty, which is just a different way. It's sort of like keeping the surface where possible and making the reductions from more internal, hidden places. There are, you know, there are a lot of them, but I think that with each of them, you just have to be thoughtful. They're not for every patient, and with each technique, you really have to say, you know, what will this do long term, and will it be beneficial? I think it's important not to jump on every bandwagon, because some things, as they play out, you realize aren't necessarily a good idea.
So for each patient, it's literally like an empty canvas and seeing what they personally need.
Yeah, and we're just seeing them for who they are, and then also having that eye for, you know, how do I make them look their best? So yeah, it's sort of an open field in that way, and there are, you know, it's definitely a partnership, and then also, you know, what I can use and how I can use it to bring about the best outcome. But I'll tell you, and I'm so proud, you know, New York City is sort of like a small town too, you know, and you will go out and see your patients, and you know, they're not my patients in this situation, you know? But I'm so proud when they just look so good, so natural, and so connected. Do you know what I mean? Like because that's really the end goal, is that they feel good. I had a wonderful professor once who said, you know, this is about making people feel better, even though we're trying to make them look better. It's really, you know, if they leave the office, even having nothing done, they should feel better, you know, and I think that's true.
Have you worked on any friends?
Oh, yes,
Is that hard?
Friends, family. It isn't, like, you know, I haven't been in a situation where it I don't want to say it's not. I mean, every patient is like the ultimate humbling experience is someone saying they trust me, you know, like so that's true for, you know, friends, family, you know, you know, there's no difference in that way. I mean, no, I mean, you really want to do a very good job. You know, like, so, and that's true for everyone. So, and sometimes I feel it's important, and maybe I feel I'm going to spend a little more time on this, you know, than someone who, if they went to someone and they were just another person. I don't know. I mean, that's not, you know, but I just, but I feel that I take that kind of interest in attention to detail and things like that.
I wonder if many surgeons do take friends and family, or if they say no.
They do.
Wow,
yeah, I mean, I don't know. I can't ask for everyone. I think some do, and I guess it depends. If you didn't think that you could have a level emotionally, so it depends on what it is too. You know, I'm not doing open heart surgery on my you know, my mother. You know, like that's you know, so there are definitely boundaries. But for some things, you know, I have, and they've turned out great, and I'm glad I did it. You know, so I think it just depends on the situation and the person, and on the flip side, the person has to feel comfortable going to you, and I know that the people that do come to me do so because they're comfortable.
Well, I think on the patient side, knowing like someone, it's better for us on our end to feel like we can trust you.
And if you don't feel comfortable, then you should by all means go to the person that makes you feel comfortable.
You don't want super clinical when you're dealing with your face. You want to feel like they're on the journey with you and there's some stake in it. We've been talking about aesthetic enhancements, but your practice also does medical procedures as well?
You mean in terms of Botox and fillers?
I think that's also aesthetic. More Mohs surgery.
Oh yes, Mohs reconstruction. Yes. I don't do the Mohs surgery. I do the reconstruction.
That's for skin cancer.
Right. So a Mohs surgeon comes out of the dermatology realm, and they remove the cancer, and they do it in a way that preserves as much healthy tissue as possible. And where that becomes really important is on the face, where there's limited real estate. And so, but what I do is, for some cancers that are in some locations where it might be very obvious, or it might distort the nose or the lip or the eyelid, I will do the closure. Or maybe people just want a plastic surgeon to do the closure, and I'll do that. So the challenges are similar to a cosmetic procedure, because we want the patient to look good afterwards. It's not just seeing seeing the forest, which is maybe the whole face or the nose, you know, as a unit, and then the tree of the actual scar and where it's positioned, and will it be as noticeable if it's positioned there. So it's a lot of, you know, creative problem solving too, and you have what you're given. You know, you can't control the situation, but you can control the closure. So.
Are those experiences more fulfilling, or patient experiences different?
People have asked me that before. I don't think more fulfilling. I mean, I just think as equally fulfilling. I mean, I think you don't know how it's going, you don't know what you're going to be given yet, and so you have to think on the spot, and you have to then come up with a plan, and the plan has to work out. But you know, with aesthetic surgery also, maybe it's a little more predictable, but it's not always. I mean, sometimes they're unique.
I feel like you have a little bit more control, because you know you're kind of opening the situation up, and this you're given
well, but the patient's anatomy can be different from one person to another, and having a scar that heals well, that's not that perceptive, it's perceptible, is really important too. So those are where a lot of the elements are similar, you know. But yeah, both are fun. I like to do.
Do you have any mentors or significant influences?
Yeah, I mean, I do, and some of them it's not that you are in touch with them along the way, but
you don't have to be.
You know, my fellowship director is you know, definitely a great role model for me. I train with Dr. Kreidel, and he's in Houston, and you know, peers that are great surgeons that you know, I'm in touch with now.
I was going to say, do you just email someone for a second opinion, or Zoom someone here and there?
I have close friends. Some of them are, you know, a small community of other women surgeons.
I love that.
It's nice because they understand your, you know, your circumstances, maybe because they're living similar experiences.
Right.
But you know, I have so many male role models too. I can't deny that. I mean, all along the way.
How could you not?
Who gave me lessons in courage and strength, and you know, a dedication, and you know, so So yeah, it just depends on the situation, I think, you know. So.
You mentioned the small neck community in the city, because obviously every city is a different feel. New York City is incredible. I love living here. Are there any beauty trends you're seeing specifically in
Well,
New York?
I think by region of the country, there definitely is a culture or a aesthetic sense that's somewhat more universal. So if I can contrast Texas, maybe it's just the nature of the people. They seem very open about cosmetic surgery.
True.
And in New York, I feel the people don't want anyone to know, and they don't want to know that they just want to look good, and they don't want to talk about it, and they don't want to, you know, let anyone know they've had anything done. So it's just it was an interesting experience where maybe there was even some humor associated with it in Texas, and there is in New York too. But it just seemed a little bit more open, and maybe the style was a little different.
Or in LA,
yes,
they'll just be walking around,
and that is true. That definitely even the aesthetic sense is slightly different, West Coast to East Coast,
so true.
For sure. So I would say, you know, New Yorkers on the whole more traditional, more subtle.
That's fair.
And you know. I
do have one friend who I admire so much. She had an upper bleph done. She's walking around with sunglasses and stitches.
Oh yeah.
Those people are so refreshing.
Yes. No, and sometimes patients will say, "Well, what will I do? I'm worried about." I'm like, in New York City, no one is going to even ask you. I mean, I one time did on myself. I did a microneedling with the PRP, which they call the vampire facial. And I had the PRP dried on my face, and I went into Brooks Brothers to get my husband a present, and nobody asked me anything, you know.
So you're saying we're so vain. We don't care about anyone but ourselves. Like no one's really looking as much as you think.
No one's looking as hard as you think.
That is so true.
And that actually is such a good thing, because sometimes when people are really bothered by something, remind themselves that, you know, maybe what bothers you is not something that other people really even see. So maybe, you know, take the pressure off yourself.
There's freedom in that it doesn't. The world doesn't revolve around you. What freedom is that? To know that people aren't really studying you as much as you think they might.
Yes.
Do you think the New York City culture affects women's standards in beauty?
It definitely does, because people want to look good. I mean, you know, they kind of have to, and maybe just even with social media, we judge people visually. We've become a very visual world.
They've said post-COVID, and when everyone was staring at them on their screen, that was a little tough to.
But
to constantly looking at yourself.
We talk about like tensions. I have sometimes gone to meetings, my professional meetings, and what I notice is everybody sort of wants to look their best, and so they're all, you know. And I sometimes have I don't know, quiet protest, like not done my Botox, you know, not done. And sometimes people have said really nice things like, boy, you look terrific. And, you know, it's sometimes interesting what, you know, I think being authentic to you is, you can't lose yourself in all this. Like being authentic to you is important. Healthy lifestyle is really important. And yes, aesthetic stuff does come into play with that, but, you know, maybe not in excess.
It's funny you said that. A few times I've seen older women on the street walking, and clearly they haven't had anything done, not even Botox, and they're so beautiful. They're themselves. They're fit and healthy, and they're going a different route, and there's something really beautiful about that too.
Right, and kind of being your authentic self. But I mean,
what
and you
you're
can
happy
be
with, it shines.
Yes,
whatever that choice
exactly.
is.
And so that's sort of where I'm really happy, even about techniques with rhinoplasty and faceless, is that we're not trying to erase what makes you unique. You know, creating harmony is really probably a better way of looking at it. And not that there's any one great nose or there's any one kind of way of it. We sort of have to, even with eyelids, for example, I had an actress come to me, and she was of Greek descent, and she had had surgery done elsewhere, and they hollowed out her eye, and she said it kind of took away her look, you know, and you know, could I fix it? And we did some things to make that better. But, you know, not wanting to kind of change someone's look. Another eyelid case I can think of where someone naturally, ever since they were younger, had a hooded eyelid. She's like, that's kind of me. That's, you know, so can you make this better without taking away that natural hooding that I have that makes me me. So I love that. And that's where, so then when you ask about the reconstructive stuff, and the individual's qualities that make them them. You don't want to lose that. You don't want to erase that. Yes. That's sort of, so.
And that's
what
gives that refreshed look.
Yeah.
Where people are like, they just look really great.
Good. Yeah.
That's the goal, right?
So, right, exactly.
You brought up this actress. Are there celeb secrets that people don't know about? I mean, part of me wants to say, I think perhaps there's little things potentially being done throughout their life, which is why they don't seem to age some people.
And I think, and maybe some do better than others.
Sure.
On the short term, I think that sometimes if you have to be camera ready, there are lots of little things people do, from taping their skin or hair extensions, maybe, I don't know, but so yes, I mean, there are certain things that will get you sort of red carpet ready, yes. Right? Skin treatments and things like that. Right. But I would say that the formula is probably different for every patient, yeah. But certain things that, like exfoliation and ways we exfoliate that can enhance the skin, hydration to the skin, things like that, to get people sort of polished looking without looking over polished.
Right.
There are some,
so
and so that's sort of operator, doctor dependent in terms of their view of
they're on a journey
their own aesthetic view, and whether that resonates with the patient is really what's important.
Do you have people continually coming back through the years?
Oh yeah, yes,
that's the ultimate.
That's the best thing is the long-term patients and having their family members. Yeah. Siblings, mothers, daughters, husbands.
Do you have a patient experience, one that stands out, that's memorable, or that it was inspiring
to you? So many, I feel like.
Choose one. Tell us. Yeah.
In terms of, I had a patient who, came to me after seeing lots of doctors for, just, sometimes like a melanoma can come in the unexpected places, and being able to identify it. It was, inside the nose, and manage it, and then also getting her to the place where the treatment was what resonated with her was really, really a great journey for me also. I mean, you have a woman, and, some people were saying, oh, take the whole nose, or just, and I did the initial biopsy and wanted to map everything and so that everyone knew exactly where this was and where it wasn't. And from there, they were able to kind of dictate a treatment that saved her nose
beautiful.
And her health. So,
yes, that's incredible.
So anyway, but that's another thing. Even though many people come to me for cosmetic things, I'm still a doctor. And so being able to recognize, diagnose someone, I'm looking, up close at their face. I may see something before their dermatologist saw it, and ask them about it and encourage them, go to your dermatologist about this.
Are you connected to dermatologists, or do you
we have a lot
of
overlap. Oh, absolutely.
I would think.
And we definitely have a lot of overlap and unique perspectives, so we benefit from that, that collaboration. And actually some of our conferences will include, dermatology, plastic surgery, and ophthalmology,
I get that.
Oculoplastic surgery.
It all connects.
Yeah.
Is there a beauty secret you wish would just go away?
Oh, one that I didn't favor that was more recently was there just seems to be a lot of emphasis on chins, and everybody was getting an enlarged chin, and then, and that can look really masculine on some people.
Sure.
So, you have to think of things in really 4 dimensions probably.
It's so funny what people focus on.
Yeah, but I think, I remember having a patient come to me and she said, I've just been spending so much money and I never like the way I look when I leave, and so again, taking a step back, seeing her face as the forest, the balance, creating the balance. And maybe there was so much emphasis on the chin that they weren't, focusing on the forehead and other things that would make everything look balanced. So.
And I think also there's a fear in fillers.
Yes,
People
there is a fear in fillers.
Get too much and then they don't necessarily see how their faces change. It's a very scary disconnect with fillers.
Yeah, I know. And that one is an interesting one because I think when people get, the right information, they know that in moderation it's okay, and it can be actually great in some ways, but in excess it can be a problem. The other thing is that the filler can, over time, it can last a fair bit of time. So it's not like I have to go back to my doctor every 6 months or a year to get this.
Yes.
I should, after, maybe the first couple times, but then after a while, there's collagen ingrowth, and then doing too much can be too much over time. So realizing that it's not that I need 2 every time I go to the doctor.
Right.
Or, you just have to see what's needed. So they, in the right place, there's still a role for fillers. It's just it's just not in excess.
It's gotten a little bit.
And also considering lymphatics too. In the face, you can get lymphatic congestion. So being able to, in terms of holistic things, think about facial massage and techniques.
Do you think everyone should do that?
I recommend. Not, it doesn't have to be formal, but just gentle, with a gua sha, and again, not being too harsh, but even just with moisturizer and doing, like a facial lymphatic drainage on yourself from time to time is good.
Do you incorporate that?
Yes, I encourage people to do that.
Wow, yeah. I see.
The other thing to think about is in terms of, we're exercising for our bodies, but there is some benefit to posture and things like that in terms of our neck, and and we're always bent over, and so our muscles shorten and tighten in the front, and they weaken and lengthen in the back, and being able to create that balance is really important. So it's not what I do, but it is what I encourage people to do.
Would you ever do a surgery on your child?
No, I don't expect that they would need it, so I guess it would be situation dependent. Probably not, but I don't expect that.
A little too close.
They need, that also potentially. I mean, I have colleagues who have, but it depends on what it is, obviously, and whether or not you think that you could do better than a great colleague or accomplished colleague.
Just so different.
It just depends on the situation.
It's so different in your line of work. Again, what you mentioned before, if you're a heart surgeon, you're not even able to do that on a patient that you,
Yeah, there's an ethical side to all of that too. I don't know, but then you're in other situations. One of my children was at 2, unfortunately, was choking, and I had to do the Heimlich on her. So, and in my mind, I was really just running through what I knew and was trained to do. And I remember just saying, like, please help me to do this because I don't want to have to, like, resuscitate my child. And then the corn came out.
The corn. I was like, was it a grape? Was it a
no, it was corn. And then I sat down and my foot started just shaking like this. I couldn't control it. But it was just interesting how, so yes, sometimes you're in a situation where you can't help it, and thank God you have the knowledge. What I love actually is my children often say to me, it's so good to have a doctor in the family, and I'm like, okay, well, maybe,
I agree.
Maybe for you.
A lawyer is also good, a doctor, you always want one of each.
No, but in some situations, they're cut, they need their ears pierced, so there are little things, I do those things, so.
Do you have advice for the woman that wants to get into this field, the young woman?
I would say don't be afraid. I mean, if it's something you love and you don't think you would get the same joy anywhere else, just go for it with courage. I think I still talk to women and they make a choice because they think it's too taxing or they are afraid, and I think that probably society creates those pressures too, but I guess if you really want to do it, you're going to find a way to do it. So but don't be discouraged if you really have that inside of you, So
do you find that you mentioned such a great support system in New York. Do you find that it's also very competitive in this climate?
Oh, it absolutely is. And I remember when I first came out into practice, people saying to me, well, are you worried about the competition? And in a sense, no. I mean, because I just have to do what I can do to the best of my ability, and they can worry about themselves, and I'll just worry about what I'm doing with this patient right in front of me, and then there'll be another patient and another, and it just will kind of grow. But I also knew that my circumstances were somewhat unique to me, being a mother also, there weren't that many examples of that. There were some, but there weren't that many examples of that. So how could I compare myself to a male colleague who has a wife at home, or I can't. So I just had to, I would have driven myself, crazy with that. So I just was like, I'm not going to worry about that, and I'm going to put the priority on the things that are most important, and that was my family and my patients, and all the other politicking and all that stuff. I was like, you know what? it's not important. It can be draining, and I'm just not going to worry about that.
Yeah.
You know, and so you can't be all things maybe, but pick the things you love, and maybe, and later on there'll be other things that come up. You know, we're, you know, all on this journey and growing and learning and evolving, and so maybe I'll find that there's an open field and time for other things that I just didn't do when my children were young, you know, so.
I find that all the amazing women that sit here from many different backgrounds all say this similar thing, which is why they were able to be successful. There's someone doing whatever you're doing in whatever field they're working in, but you're the only you. So just stay laser focused
on you.
And because if you're always looking around, you're never going to get anything done.
Yeah.
You could be paralyzed by fear, whatnot. Just.
And you know, I have 3 daughters, so and watching them grow up, you realize the things that hold women back sometimes are the, you know, girls who are sort of taught to be hard on themselves in some ways, and to, you know, you don't want to do things that are going to pull you down. So don't do them.
Right.
Focus
I love
on
that.
the things that are going to you know, make you stronger and feel positive, and you know, be good to yourself. You know, too. I mean, that's really, really important.
Yes.
So yeah.
Thank you so much for being here.
Oh,
Your
you're
daughters
welcome.
have such a beautiful example.
Oh, thank you.
Just your daily life and how your perspective on life, and how you've built your practice, the successful practice, and I think mostly your view on life. I think it's very beautiful and positive.
Thank you. I feel very grateful. I mean, I feel very grateful for my children. They're amazing, and you know, like you just feel, you know, that gratitude.
Yeah.
And,
but when you live a life of gratitude, it is vastly different than seeing what's wrong around you, because there's plenty wrong every day if we want to find it.
Yes, absolutely.
When you're focusing on the gratitude, it makes life so much sweeter.
And it doesn't, you know, you have hard times too, but you know, you're just going to you know, face them as they come.
Yeah.
I think that's the important thing to remember. It's not like it's just easy, or, you know, some people just don't have. No, we all have
Nobody
those challenges.
has it 100% easy.
Yeah.
Right. So thank you,
You're
Lee.
welcome.
It
Thank
was
you
wonderful
so much.
sitting with you.
It was great talking to you too.